Welcome to the Geriatric Dietitian, your go-to resource for nutrition that supports health, independence, and confidence in aging. I'm your host, Katie Dodd, registered dietitian and geriatric nutrition expert. Let's dive in. Hello and welcome to the 14th episode of the Geriatric Dietitian Podcast, Dry Mouth in Older Adults. Now, in our last episode, we talked about why oral health matters and why I always say the first route of nutrition is the mouth. So today we're going to be diving into a very common topic related to oral health in older adults, and this is dry mouth. Now, dry mouth might not sound like a very exciting topic, but it's one that deserves a lot more attention. If you struggle with this, you automatically know. But if you don't, if you're a caregiver or a healthcare professional listening to this, think of if you've ever woken up in the middle of the night and you feel like your mouth is so dry and you're just so uncomfortable and you need a glass of water. Imagine how that can feel day in and day out, all day, every day. And for many older adults, this is exactly what they're experiencing. Dry mouth can make eating uncomfortable, increase the risk of dental problems, and ultimately impact nutrition status. So as dietitians, caregivers, healthcare pros, this is something that we're always focusing on and should be paying attention to. So first off, let's talk about what exactly is dry mouth. The medical term is xerostomia. Now, I don't know if I'm pronouncing that entirely correctly, but it is spelled X, not Z, xerostomia. And xerostomia simply means there's not enough saliva in the mouth. Now, most of us don't spend too much time thinking about saliva, but it's actually incredibly important. Saliva lubricates the mouth. It keeps it clean. It helps us to chew, to swallow food. It actually helps food taste better, and it even plays a role in speaking. Without enough saliva, food and bacteria stay on the teeth and the gums longer, increasing risk for cavities and gum disease. So while dry mouth may just seem like an inconvenience, it could actually have major consequences. Now, we know that one of the most common causes of dry mouth, especially in older adults, is medications. Many prescription and over-the-counter medications list dry mouth as a side effects. And we know that many older adults take multiple medications. So it's not a surprise that dry mouth becomes increasingly common as we age. But also, research does suggest that older adults may naturally have reduced flow of saliva in their mouth regardless of medication use. So in other words, some older adults will experience dry mouth more than any other age. And, you might be listening and being like, I don't have dry mouth at all. Or you might be like, oh my gosh, that's me. It really is individual. But as a dietitian, whenever we are having a conversation about dry mouth, I immediately start thinking about nutrition, because if your mouth is dry, chewing isn't easy. Think of it. We need that saliva to help break down the food and make it like a nice, smooth thing that we can swallow without choking. And without the saliva, it's not just that chewing's hard, it's hard to swallow. It's not comfortable. Quite frankly, it's not safe. You can choke. Food also, again, might not taste the same. We don't think often of the role that saliva has in making food taste good. We also know that even the breakdown of nutrition starts in the mouth with saliva. Carbohydrates are starting to be broken down in the mouth, which can cause them to taste sweeter. So it's just a whole different experience if you are lacking saliva, and meals become less enjoyable. And when eating becomes difficult or uncomfortable, people often start eating less or avoiding certain foods altogether. And this is why dry mouth isn't just a dental issue, it is a nutrition issue. It could lead to unintended weight loss, muscle loss, malnutrition, excluding entire food groups, not getting the good nutrition that our bodies need. So what can we do about it? The good news is there are several practical strategies that can help with dry mouth. The American Dental Association, the ADA, recommends sipping on water or sugar-free beverages throughout the day. And this is important because if we are sipping on beverages that have sugar or carbohydrates on it, that can actually cause issues with the teeth and contribute to the decay. So water, or if you're like, I don't like water, finding sugar-free beverages. This could look like Crystal Light. I mean, there's a whole host of sugar-free beverages available on the market today. Other things that you can do, suck on ice chips. Use lip balm if your lips are dry, because if the mouth is dry, the lips are going to be dry too. Chewing sugar-free gum or sucking on sugar-free candy can also help to stimulate saliva. and drinking fluids with meals. So we talked about chewing and swallowing being hard. So having fluids that you're drinking while eating to help provide more moisture. They also recommend avoiding foods that are very salty, very spicy, dry, or difficult to chew. It's all kind of individual, so you do have to do what's best for you. They also recommend limiting alcohol, tobacco, and caffeine, which can further irritate dry mouth. They also recommend brushing and flossing every day. We talked about that in our last episode. Using a fluoridated toothpaste and seeing your dentist regularly for exams and cleanings. And then talk to your healthcare team about additional options that are out there, like salivary stimulants. I'm probably pronouncing that one wrong too. You guys will learn as we progress in this podcast. Pronunciation is not my skill set. So salivary stimulants or artificial saliva may be appropriate depending on your situation. So talk to your doctor about options. So as dietitians, one of the biggest things we could do is simply recognize the problem. If you're experiencing this yourself, or again, if you're a caregiver and you're noticing someone saying, man, food is sticking to my mouth, I've got to take a drink with every bite, I'm avoiding dry foods, or even eating isn't enjoyable, consider whether dry mouth might be a part of the picture. Sometimes just asking that additional question can uncover a problem that's been affecting someone's nutrition for months or even years. One of the things that I found is I always have to be so cautious when I ask someone, do you have difficulty chewing or difficulty swallowing? Oftentimes people will tell me no, because they're like, well, is it difficult? No, I've learned to deal with it. I've struggled with this for months and years, and I've just learned to deal with it. So it's not difficult. It's definitely not normal. But also, when we've dealt with something for so long, we might just think, oh, this is a normal part of aging. There's nothing I can do about it. I've always had dry mouth. This is just the way it is. So I'm always cautious when I ask general questions without probing. Because what I've realized when I ask any difficulty chewing and swallowing, they might say no, but the reality is they are struggling with issues. It's just they've learned how to work around it, right? So the more we can probe and deep dive in figuring out, okay, is this an issue? And you might be listening and realize like, oh yeah, I do struggle with dry mouth. I didn't even know there were solutions. I didn't even think about these things. I didn't even think about how, the lack of saliva is what's causing me to hate meal times and why eating is so miserable. So awareness is huge. Dry mouth is also especially important in older adults receiving palliative or end-of-life care, because during this season of life, the very final season of life, comfort becomes one of the highest priorities. And so anything we could do to keep the mouth moist makes a tremendous impact on quality of life. So, key takeaways for this episode. Dry mouth is common, but it shouldn't be ignored. Something as simple as saliva or spit plays an essential role in chewing, swallowing, tasting food, protecting teeth, supporting good nutrition, oral health, overall health. When we recognize dry mouth early and help older adults manage it, then we can help them to continue to enjoy food and meet their nutritional needs. So thank you so much for listening to today's episode with the Geriatric Dietitian. In our next few episodes, we're going to continue this conversation talking about oral health. We're going to be diving into missing teeth, dentures, chewing difficulty, and all the things. So remember that the mouth is the first route of nutrition, and we need to be taking care of oral health because it has such an important role in nutrition and healthy aging. I'll see you in the next episode. Want simple nutrition tips to support healthy aging? Download my free guide, 10 Essential Nutrition Tips for Healthy Aging, packed with practical ways to stay strong, nourished, and independent as you age. Grab your free copy in the show notes or visit thegeriatricdietitian.com.